Welcome to Dear Sandy. I'm Sandy Galef, a member of the New York State Assembly, representing parts of northern Westchester and parts of Putnam County. And today we're going to be talking about our children, our youth, and many, many issues surrounding them. And I have two special guests with me today from the Westchester Children's Association. And first I'd like to introduce Cora Greenberg, who's Executive Director, and also Myrna Forney, who is a board member.
Yes.
And we welcome both of you to be here.
Thank you.
And, you know, I know in the Assembly and in the legislature we talk a lot about kids' issues, you know, whether it's education, whether it's adoption, whether it's family issues, daycare, childcare, all these things, and it's always very hard for us because we know we need to do a lot of work to be sure that our kids have the ability to grow and prosper, and you know, reach their potential. And then you start to see some of these figures, and you realize that there's so much to do. And I know, Cora, you actually ask legislators to come periodically to talk about those things that we really need to do. Tell us about the Westchester Children's Association, kind of like the history of what you do.
Yeah. Okay, well, it is a fascinating history, Sandy. The organization was started in 1914, and the purpose has not changed. The purpose of the organization is to identify what children need, to make those needs known, and to see that they are met. And we've done that for nearly 100 years in a variety of ways. We research, we gather a lot of information, we work in coalition with a lot of partners who are direct service providers. You mentioned educators, physicians, social workers, to find out what's happening in a variety of systems that affect children. And then we make recommendations to government and also to other organizations about how we can improve the lives of children. So our job has changed in many ways, but it also is the same because, as you said, there are always things that children need to make sure that they do reach their potential.
So have you seen a lot of, well, you weren't there in 1914.
No, I wasn't.
You started in 1994. But even since 1994, has there been a switch in you know, issues or problems or you know, whatever is going on between that time?
That's true. I would say that when I started, teen pregnancy, for example, was a very worrisome issue. Not that it isn't anymore, but the numbers have changed dramatically. The number of young women in their teen years who are becoming pregnant has gone down a lot in Westchester County and actually throughout the country in the time that I've been at the Children's Association. So that's one example of things that change. But other things come up at the same time. I think the reason that there's this continuity is that what young people need to grow hasn't really changed. That children need the basic building blocks no matter who they are, no matter what their family circumstances are. And they can't wait for the economy to get better, or you know, a 3-year-old needs what a 3-year-old needs when they're 3. They can't wait till they're 7 to get what a 3-year-old needs. And so that's part of our job, is to stay and try and keep children at the top of the public agenda so they don't get lost in the sauce when other things
Well, they're
come
not
up.
out there protesting.
No,
I was going to say that
Yes.
I think that's why Westchester Children's Association, it has been here and is always going to be here, because while everyone cares for our children, their voice is not always at the table. And what Westchester Children's Association really does well is make sure that their voice is always at the table, that we know that everything that we do touches on our kids, and so the decisions that are made have to be made with them in mind. And that's the strong advocacy nature of Westchester Children's Association.
Yeah, Myrna, you're on the board.
Yes.
Now, why did you decide to get involved in this?
Well, what has always been a passion for me, and as an attorney and as a mediator, is always working with kids in mind. I have been an attorney. I'm on the Attorney for the Children panel, which is a law guardian in Westchester. In my past career in California, I worked with children, and I've always felt that the one thing that we must do is keep them in mind in all of our decision making and in all of the processes that go on legislatively as well as in our educational systems. And when I moved to Westchester, Westchester Children's Association was brought to my attention. And it's a fabulous organization that really does work daily at making sure that the children's needs are met. And people often say, well, it's Westchester County. Are there really any needs that need to be met
I know
here?
that's what's so amazing, because we're the one of the wealthiest counties in the country, highest taxes, and yet we have all these needs, and we have people and children that fall through the cracks.
Absolutely,
Yeah.
absolutely. And I think that that's why it's an important organization. And for me, it's an organization where, as a board member, I can actively be involved. We, as board members, we help make decisions with regard to the issues that we address, and it really gives you the ability to be involved in the community and to actively reach out and help and find solutions and talk about the issues and bring them to the forefront. So that's what made me interested in Westchester Children's Association.
Cora, you've brought a chart here.
Yes.
And, I'm just amazed at some of the numbers on there.
Right.
They're rather distressing.
Right.
I'm right now looking at 30% of children under 6 live at the 200% poverty level or below.
Right.
This is Westchester County.
That's right.
Right.
And this is an example, we call this a dashboard. This one is about children under the age of 6. We can do this for any issue area or any age group, but we have a project over the last several years called Westchester Children by the Numbers, where we really gather and analyze a lot of statistical information to illuminate the well-being or what's happening, the status of children in Westchester. And you're right, people are very surprised to see some of the numbers. Westchester is a very wealthy county overall, and overall children are doing well here. But when you start to pull apart the averages and you understand that 11% of children under the age of 18 are poor. And what does poor mean? It means for a family of 4, their family makes less than $22,000 a year in Westchester County. That's a pretty difficult level to live at. And so that 30% we peg to the 200% poverty level, just to give a more realistic idea. But that's one example. Another example is that even in the wealthiest parts of our county, there are some poor children. So they're concentrated in certain areas, but they really are to be found almost everywhere. There are families who are really struggling. So these kind of numbers really help us illuminate and, as Myrna said, bring to the fore what children need and what we should be paying attention to if we want to really help the next generation thrive.
So when do we start to pay attention when do we know more about their needs? When they get into school? That's like the first setting, or maybe if they're in daycare. I mean, is it a setting beyond the home where you really find out, what the problems are?
Well, I think there are settings even before daycare. For example, in Ossining, you have the Open Door Medical Center. Many families
The
go
pediatrician.
there,
healthcare
and
center,
they
right.
are very much attuned to the social, emotional, health, all kinds of needs of the families who come and try to connect them. So there are opportunities for people to be aware. I think the challenge for us is to bring that awareness to people who are not necessarily either personally affected by the challenges or professionally affected by the challenges. To the general public, we call them the compassionate majority. People do care about children, but if they don't know that there is a need right in their own neighborhood, in their own county, then they don't really respond. And we're really trying to bring that message that there are needs here and there are solutions here. There are things that we can do as community, as government, to make things better for children. And that's, we feel, is a very important role for our communities to take.
Was the Westchester Children's Association, were they ones that saw the need and then got volunteer? 1914 women weren't working.
Right.
Did they see the needs and then go out and as a volunteer if they saw that people needed coats or mittens in the
Absolutely.
wintertime, or there were food needs or book needs? Is that what did they go out and start to pull things together and find the
Yes,
kids? And
they
do
did. Well, and the kids, and they work closely with county government to help do that. So if you had young people in foster care, for example, in Ossining, the Ossining chapter of the women who were involved in the organization would raise money to buy gifts for them at holiday times, to buy new clothes at school time, and sometimes even very personally, we had records in our office, we have records from a long time ago, where they'd learn about it, say, a young man who wanted to go to barber school and needed $300 to go to barber school, and they'd raise the $300 and send him off to school. So it was very hands-on, but at the same time, always with an eye to what is the big picture here? What if this young man needs vocational education? How many other people need that? And how do we systemically address that issue? So there was always two sides to the effort to help individual children, but more importantly, to change systems so that more children would get what they need.
And we had different kinds of ways to take care of kids that had no parents back then. And now, we have the foster homes in most instances. And I think you've been involved, haven't you, Myrna, in foster care issues and whatever?
Yes. I think the thing that made WCA coalesce into now an organization that works with at the county level and at the local level and even at the state level is because now funding for programming that helps the same kids that would have been helped in a more diversified manner through the different community groups now really comes in larger areas. You have to go to the state level, you have to go to the county level, you go to the local governments. And so now at what Westchester Children's Association can do is it really gets to look at how that funding is being disseminated throughout the county and looks at the numbers of children who are really in need and kind of can say, you know what, we still need that program because we have X number of kids who need that kind of assistance.
So when the county is doing their budget or the state is doing their budget, then I guess you would come through and say, this is what we have determined are the needs of this year.
That's right.
A list, but these are the priorities. And if you have funding issues, which we're all going through right now, to try to direct the funds to the ones that are more key issues, I suppose.
And in this environment, it's really just to, again, keep children in the budget in whatever way we can, because there is so much pressure on government at every level to cut spending. And yet we make the point that in our own families, when we have a budget crunch, we don't start by cutting what children need. We start somewhere else with things that are a little bit more expendable, and that's what we urge governments at all levels. And of course, we've visited with you. And, but that's our job, as Myrna said earlier, to speak for children who aren't always able to speak for themselves. We do work with youth groups too, because they become activists. So we're growing the next generation, and parents can speak as well. And we're just trying to organize that and give the ammunition to advocates with statistics like the ones we showed you on the dashboard, and with analysis that says, we think we're doing very well in Westchester, and yet among African American and Latino youth, only 60% graduate high school in 4 years. I mean, that sort of thing. That again, people thinking, well, gee, I didn't know that. My kid's doing okay. It is a community issue, and we believe that when we give every child that opportunity and this ability to succeed to their highest potential, we all benefit.
We do.
Absolutely. The community all benefit.
Well, we know that it's all prevention. It's preventing, children to go the wrong path. We want to keep them on the right path. That's right. You've started a campaign like Vote for Kids.
Right.
I guess that's a continuation of what you were just talking about.
Yes, well, we've sort of formalized it more this year, where we've become a little bit more technically savvy. And our attempt was to really do a multifaceted engagement campaign around election time and around budget time. So we really are encouraging people that agree with us to send messages to their elected officials, first of all, to let them know that they, the public, care about children and want their elected officials to put children first. So that's one part. And then we've done some candidate questionnaires around election time. We publish the answers to those questions about children from all the candidates. We publish scorecards of votes that legislators have made on pertinent children's issues so that we can educate the voters about who is for kids and who's just kidding. So that's an
Who's just
important.
kidding?
Yeah. And everyone will say they're for kids, but how are they voting is
Right,
really the answer
right.
to the question. So I think that is going to be a continuing project that we can use for elections at any level. We have
Absolutely.
the presidential election coming up next year, and we have a lot to do. But I think trying to engage that compassionate majority to say, oh, wait a minute, yes, we want our taxes lowered, but we don't want children's services to be cut from the
Right.
budgets.
And I think that's the thing that Westchester Children's Association is also effective at, because I think when people hear issues around the budget and hear issues around decisions and legislation that's going on, they don't necessarily look at that legislation and those budget cuts to say, what is the actual impact? You know, what is they see the big impact, but are there any little things that are, tangentially or directly connected to it? And I think what Westchester Children's Association has been very effective at, and even with Vote for Kids has become even more effective at, is going, okay, well, that's the budget cut, and you're right, it's going to give you this relief, but it's also going to eliminate this level of assistance that directly impact our children. And that has been able, I think, to persuade people to think a little bit differently when they're making their decisions.
Right. I'm actually looking over your shoulder, Myrna, because there's something there about emergency room admissions occurring for children under 5. And, I was thinking about the county and this whole issue of healthcare clinics and so on that have developed throughout our county, which I've always supported because it's more local and they provide wonderful health services. And to think that children go to the emergency room. Yes, you go if everything
Right.
is closed. You go to
Right.
the emergency room.
Or you go if your child breaks their arm
Right.
falling off a
And that happens
swing.
often on the weekend.
Yes, it does. That's right.
But if it's during the week and something is open that would have your doctor there, it's so much better for a child to have that consistency instead
Certainly.
of going to an emergency room, which actually that visit costs more
Exactly
than it
right.
does in a healthcare center.
Right.
So from a financial perspective, it doesn't make much sense, but it also for children. So, that's
Exactly.
one of your issues up there.
That's right. And that's a great example of something that it looks great to say we're going to cut this expenditure and won't that be terrific, but sometimes those cuts have an attendant cost that may be greater. And so to say, okay, well, you don't need to see those uninsured people for whatever the amount of money is, let those people go to the emergency room, and as you just pointed out, that's just coming out of another pocket
Right.
of the same people to pay at a much higher rate. And so we're trying to be truth tellers. We're trying to, we're completely nonpartisan. We're not interested in supporting people. We're not allowed to support people for election. So it's not about that. It's about the issues, and it's about speaking the truth about what children need and what they're getting or not getting. So.
And of course, childcare is, I'm assuming that when you think back to 1914, I suppose it was a very informal childcare arrangement.
I'm sure that's
if
right.
women were working, and there probably weren't so many, but very informal. And over time, we've developed, Head Start came along, I guess, first.
In the 60s,
And then you had daycare, and you have pre-kindergarten. I mean, we've had a lot of different levels.
Right.
And I'm assuming if you're talking about protecting children through the education spectrum, all of these are really a part of that education
They are.
movement.
They are, absolutely.
They are. And even, I would say, even before you think about daycare, that child development, we want to think about that child from the moment they arrive and what they need to develop in healthy ways throughout. So children aren't in little boxes. It's not, okay, right now you're in your education box and you leave all your feelings and you leave your healthcare needs and you leave your nutrition needs somewhere else. It doesn't work like that. They come to school and they have all those other needs too. And they have them when they're born and they have them when they're 2. And so they're learning right from the beginning. They're growing and developing right from the beginning, and that continues. So it's this holistic approach, and our advantage is that we are a multi-issue advocacy organization. So we're not just about education, we're not just about health, we're not just about foster care. We can look at any issue that rises to the fore and say, all right, how does this fit into the overall system of care that children need? And we always try to have that broader perspective.
Kind of a whole child.
Yeah.
So where do you get all of your information from?
It's all public. It's all public
public
information that we draw from other sources, county, state, some federal. The census, of course, is a huge source. And we have a wonderful director of data analysis named Limarie Cabrera, who sits at her computer. Sometimes she's yelling, and sometimes she's muttering under her breath, but she really analyzes all this, and it's all available for free on our website in a searchable format. So if you want to look for population data or you want to look for education data, one of the most important things that our site does is it breaks things down smaller than the county. Because for Westchester County, countywide averages are pretty meaningless. To say that there's an 11% child poverty rate, well, it's less than 1% in Pound Ridge, and it's over 26% in Yonkers. So 11% is meaningless. People want to know about their own community, how are children doing right here, and that's a good place to start. So we have a lot of information that's broken down by community, by school district. People can kind of browse around and look for what's there, and it's a very interesting place to start to understand how children are doing in our county.
So if there was a volunteer group out there that wanted to do something special for children, they could go up on the list, they can look the area that they cover as a volunteer group and see where those needs are, and then try to plug something in that will help, whether it's, I don't know, training new moms. You know, I remember a program just teaching moms how to teach kids to read, because not everybody is so, you know, aware of the importance of reading, I suppose. But so they could go and get statistics and try to figure out, and actually work, I suppose, with your agency to
well, we would be happy to talk with anybody to help them understand, first of all, how to use the data, and how to then go from, as you said, looking at what the need is and thinking about what to do. There are lots of wonderful programs that already exist that would love to have more help. So that's always a possibility. But starting with what's the reality was our effort with the numbers.
And another great thing that WCA has as its strength is it's very much a coalition building organization. So even if people were to come and say, I live in Ossining and I really want to know what's going on, not only does WCA have the statistics and the data for what's going on in Ossining, but they also have relationships with the programs and that are already in existence in many of the communities. So it's also a way to kind of connect people to the things that are going on in their own communities.
So we've talked a lot about the younger children. What about the adolescents? What a difficult period of time.
It can be.
You know, what have you seen are the greatest needs in that area?
Well,
you mentioned teenage pregnancies, and that was down, which is good.
But you're right. We always have our eyes across the age span. We have a project right now that actually grew out of our work looking at young people in foster care and how well or how ill they were being prepared to leave foster care to grow up and be young adults. And that led us to this broader group of young people, very broadly called disconnected youth. These are young people 16 to 24 who are not employed, not in school, not in training, people that have sort of fallen off that developmental track. But that can happen to anyone. I mean, anyone knows people in their own community where there's a guy or a gal who either dropped out of school or finished high school and now they're hanging around the basement. And that can happen to anyone, because young people, when they're teenagers, they make bad decisions. That's part of it. The difference is what opportunities and supports are there to help them reconnect. And so we've been looking at what are some of the needs right now in Westchester and some of the solutions that have been working well to help young people who have disconnected to reconnect. And Myrna's been very involved with that project.
Yes, we are actually we have a group called Connecting Youth that's working and doing research with regard to the Westchester County and finding out the programs that are now actively involved with young people who fall into the age range between 16 and 24 and trying to get it reconnected and finding and really looking. We're actually right now working on really looking at our community and saying, okay, so what programs do we have in existence? what programs do we need, where are the gaps, so that we can really kind of reach out to our young people, because it's interesting that people often think of disconnected youth as those youth who came out of the foster care system, and those are a large portion of them, but they are also, as Cora said, within every community. And there are young people who, for whatever reason, did not have the supports that people normally think of, whether it be directly with parents or grandparents or relatives. And once those supports fall away, you often find that kids do what kids do. They have no way to reconnect. And so what we are looking at right now is trying to find the places where those gaps are, and kind of being able to report back to the community that these are the places where we need to look for supports for our young people.
Very, very interesting. I would assume that, you know, from 1914 to now, with divorce rights and everything, that is also worked into it, and they're not foster kids, but but there may be some issues that develop from that.
Sure. Well, I think there are lots of family issues that happen regardless of marital status, but there are certainly a lot of stresses on family economically, relationship-wise, and almost every other way that often the children are the ones that bear the brunt.
Right. So now we have a new legislative year in Albany.
Yes.
And are there issues that you think that are going to be high on your list with the state legislative body?
One of the things that we've been working on for the last couple of years is to try to increase the number and amount of programs that provide early childhood home visiting. You talked earlier about helping young mothers. There are a lot of young parents who don't have the supports of extended family around them and are low income and have other stresses in their lives. And a home visitor who comes in is trained and can come in and help that parent learn about child development, connect them to other resources, and really help support the family through those first couple of years. Research has shown that makes a lifelong difference for the child. They are more likely to graduate from high school. They are more likely to not be in trouble with the law. They are more likely to be gainfully employed. It has a very, very profound effect.
Have we started much of
We
that?
do have some programs in New York State. Healthy Families is one that actually is operating in Yonkers. Nurse-Family Partnership is a national model that is not in Westchester yet, but is very, very promising. And there are a couple of other parent-child home program we do have in Westchester. So there are different models, but there are many, many more people who could use this support who don't have it. And there's some federal funding, but we want New York State to help us get that funding and to see if we can get some more money into the state budget.
I want to
for
thank
that.
you so much, and
Thanks.
I will do what I can, certainly, and I think the conversation has really highlighted the needs of our children. I thank you, Cora, and I thank you, Myrna, very, very much, and I'm sure that we've put up information throughout the program about where people can contact you. And I just want to thank you again for your good work
Thank
on
you,
behalf
Sandy.
of children.
Thanks so much.
And I want to thank all of you for watching. If you have any questions at all, or you want to get in touch with my guests, please give me a call at 914-941-1111. Thank you. Have a good evening. Much for watching. Have a good evening.
No, no.